So come over and film looking down on his heels. So we did restore good mobility in the subtalar joint on the left, and you can see that I can now easily rotate calcaneus outward. But by design, his heels, they hang out in a position of inversion. Okay? And when I try to take it to neutral, I can't even get to neutral. So if we were to draw a line down the calf, it would come this way, and the heel is out like this. So that's how he's made at the factory. He just doesn't have eversion past a couple of degrees. And so we're providing a heel wedge that goes, the tall part goes under the medial aspect of the heel. And can you tell us how you feel when you walk with that wedge?
Yeah, it's definitely made it feel better.
And we're sending him home with what I believe are 7 millimeter and 4 millimeter wedges to use that as an experiment. Okay, so there's that. And now I'll show the increase in hip extension. Okay, and then lie on your back. And I'll show the gain of internal rotation. Now it doesn't go quite as far as the right side, but it has a soft end feel. Because it now has a soft end feel, then I know that this will always rotate less than the right. And that's a factory defect. Factory setting, let's not say defect, let's just say factory setting. So, let's look at the mobility. I did not have to treat the cuboid. I mobilized the fibula superiorly, and now you can see there's a little bit of joint play. And then when I hook the front of the malleolus, I can spring it towards the floor. There's good mobility there. And I worked on both of those, and then when I came and tested the fibular head, then it had normal movement. I can spring that forward. So then we found that then I came and treated the subtalar, restoring abduction of the calcaneus. So that's outward movement of the foot, medial movement or twisting of the heel towards the right. And that's now improved. Okay? And then I treated midfoot, and you can see he now has midfoot pronation. Okay? Can you tell us how you felt walking?
Ah, it's amazing. Totally different.
Very good. So we already showed the self-treatment. We already filmed that. But I'll go ahead and separately film the self-treatment with a little more detail.
Okay.
So thank you very much. This is a nice demonstration of how restoring these movements in the hip and the ankle restored movement in the cuboid. And this is the 5th metatarsal. It has a flare at the bottom of it, and you can fall down into a sulcus, and then cuboid is right above that. It's 1 finger width above that. So I'm grabbing cuboid, and his cuboid moves up and down freely. So I did not have to mobilize the cuboid directly. Its motion was restored when we restored movement in the other joint. So maybe I should name this film How to Mobilize the Cuboid Without Touching It. So I'm glad you're better. I think you're going to do very well with the maintenance program. Very good. Thanks.